physicians associates and anaesthesia associates have been found to have acted illegally in 1 in 8 NHS trusts, according to LBC. Yesterday, the British Medical Association, the BMA, launched a legal action against the General Medical Council over the regulation of these roles, neither of which require either a medical degree or a postgraduate medical training. Now, under the terms of their employment, physicians associates and anaesthesia associates are not allowed to perform acts which are the preserve of clinicians. On paper, their main duty is to lessen the burden of doctors by helping to manage patients and reduce demands on their times. But LBC found that PAs and AAs, as they are called, have acted beyond their purview or remit in 1 in 8 NHS trusts, attempting to prescribe medication and commission ionising radiation scans, tasks that they have no right to carry out. Now, this Freedom of Information request was made to over 50 NHS trusts. The findings have been described as staggeringly high by the co-founder of Anaesthetists United, Dr Richard Marks, whose organisation has launched a complementary legal action against the GMC, the General Medical Council, over the regulation of anaesthesia associates. And speaking to LBC, Dr Marks warned that the figures could be the tip of the iceberg. And he said this, and I quote, "It's a staggeringly high figure for 1 in 8 trusts to admit that people in their organisation are acting illegally. And I stress, it is illegal. There are specific laws on prescribing and ordering X-rays and ionising radiation." Now, I find this all pretty disturbing. And my question to you is this: is patient safety being compromised by using cheaper, because let's face it, it's a cost issue here, cheaper physician's assistants and anaesthesia assistants, but you get the point, than hiring doctors? Is patient safety being compromised by using cheaper physician assistants than hiring doctors? 0345 6060 973, text 84850. Ask Alexa to send a comment to LBC. And I want to ask you specifically, have you been engaged by a physician's assistant or an anaesthesia assistant? What was your experience? Did you know that they were an assistant rather than a doctor? Were you confused? Was it clear to you? Was it made clear to you? What is your experience if you have personal experience? And if you are a physician's assistant or an anaesthesia assistant, why is this happening in your view? Is it because NHS, certain trusts are trying to get things done on the cheap, that your remit has been expanded beyond where it should be, given the training that you have? Do you feel exposed by this? Do you feel comfortable that you're being asked to or expected to prescribe or to recommend for scans certain patients? Because there have been errors that have occurred as well, which I'll come to in a few moments. How do you feel about it? So I want to hear from you if you're a patient, if you are a physician's assistant or an anaesthesia assistant, and also if you're a doctor. How do you feel about this? Do you feel that your profession is almost being de-skilled here, that these are basically doctors on the cheap? And how does that make you feel in terms of patient safety? So it's an open forum for you to discuss this question. Is patient safety being compromised by using cheaper physician's assistants than hiring doctors? 0345 6060 973. Now, joining me is Dr Matt Kneale, former co-chair of the Doctors Association UK, who's led campaigning over the use of physician associates. Very good evening, Matt. We have found that physician associates are being used illegally in 1 in 8 NHS trusts. What are these people doing, and does this news surprise you?
Thanks for having me. Yeah, it's astounding, isn't it? And I think any reasonable person listening to that story would be going, surely this can't be true, but I can assure you that it is. And for our own kind of research and the research of journalists elsewhere as well over the last, year or so, this really just mirrors everything we've seen elsewhere. We've seen multiple trusts breach good standards, really, best standards on prescribing, on using ionizing radiation. The list goes on, and unfortunately, we have seen patient deaths as well nationally. So you can understand why there's concern from doctors.
Why were physicians' assistants and anaesthesia associates actually brought in the first place?
I think they were there to fix a problem that actually didn't really exist. Ultimately, there were a number of solutions put forward, back in the early 2000s around how we can free up doctors to do more advanced work, more maybe senior-led work, attending clinics and going into theatres, those sort of things. But the way we've gone around that is just wholly inappropriate, and I think we've ultimately we're reaping the rewards of having an unregulated profession around for so long now with these PAs and AAs. I know there's discussions around getting them under the GMC as a regulator, but it feels wholly inappropriate. This is a regulator for medical doctors, and to blur the lines by putting them under the General Medical Council just seems grossly inappropriate, really. In terms of why they're there and why they continue to be there, you do have to ask larger questions about why. I agree, and it doesn't make sense when you look at the economics of it. What they're paid versus doctors, the roles that they're fulfilling versus doctors, and in some cases being on medical rotas and things like that. You have to start asking about essentially tinfoil hat conspiracy theories. Are we just trying to phase out doctors for economic benefit?
Are these people regulated in any way at all?
So, not presently. Obviously, the plan is to come under the General Medical Council. The way that they've been doing it so far is to have this kind of ad hoc, informal regulation by individual colleges. So the Royal College of Physicians used to regulate, and still does to an extent, PAs in hospital, in general practice, and likewise for the Royal College of Anaesthetists with these anaesthesia associates. Unfortunately, those colleges have no statutory powers, so they can't actually investigate, fitness of practice concerns or, grossly inappropriate behaviour, conduct. They rely on the goodwill and good practice of employers, to report rogue PAs and AAs to them, and they can then take them off this voluntary register. Whereas obviously a statutory regulator, such as the Health and Care Professionals Council or the GMC, which we disagree with, can take further power, and they can take legal action to restrict the practice of rogue kind of PAs and AAs. So essentially, to answer your question, no, there isn't any good effective regulation. There's nothing to stop someone who's done something wrong, who hasn't been reported by their trust, to move jobs, essentially. And we've seen that nationally. We've seen cases where, unfortunately, there have been patient deaths. There's one instance I'm thinking of in particular where this PA has essentially been involved in a patient death. It's been investigated grossly inappropriately by the PA themselves and a consultant who's involved in their care. And then essentially they've moved trust afterwards, and they're still working. So there's no good regulation in place at present. We agree that some regulation is better than no regulation, but it's really unsafe to be merging and blurring lines even further with doctors for people who lack any degree of the same level of education.
Do you think that the key issue around why this is basically illegal is because these physician's assistants and anaesthesia assistants are prescribing medication and also, in some cases, commissioning scans of certain kinds? Is that the fundamental reason why this is deemed illegal? They're acting ultra-vires beyond their capacities or what they have actually been recruited for.
So I think trusts are putting them in that position, unfortunately. And that's, I don't want to go on here and say that individual PAs are on every level, doing grossly illegal and inappropriate things by their own volition, because I don't think that is the case. But trusts unfortunately abuse the position that these guys are in, unfortunately, and they're using them to prescribe, as you say, and to, prescribe CT scans and things like that, off the record almost, in ways that they shouldn't be. We just have to keep at the forefront of this, really, that, medications and radiation do have harms associated with them. Unfortunately, we try and, mitigate those things with good practice and with, really thorough education, training and experience, ultimately. But these people, they lack that. They don't have the fundamental pharmacology background, in their degrees. And they just don't have the fundamental knowledge to do this safely. So, from our point of view, it's really about patient safety, and trusts are putting that at risk, really.
How much training do these people actually have when they come in?
So it varies, and unfortunately, there's no real, gold standard of what these people need to become, PAs in the first place and AAs. So there's a relatively varied background. I think the Telegraph reported a few months ago that there's people who've done homeopathy in the background. These become PAs. So there's a real mandatory requirement for them to definitely be science graduates, and graduates in biomedical sciences, for example. And they go into these courses. They do roughly 18 months, I believe, to 2 years of training. They'll come into the job at roughly a band 6 or band 7 NHS level, which is more than a junior doctor, if one would come in at. And essentially learn on the job as a vocation. And, you could make some really strong arguments for saying that sounds like a potential model that you could make work somehow. Unfortunately, I think the way that we've gone around it is not safe. I'm not saying there's absolutely zero role for PAs and AAs in the NHS. There may well be. But we're going to need to reflect and modify the systems that they're working within to do it safely, and probably the economics around it as well, because it makes very little sense on a cost efficiency level.
In your view, you say that there's a role to be played potentially for physician's assistants and anaesthesia assistants. This is actually something that is echoing what Wes Streeting, the shadow health secretary, who might be health secretary by the end of next week, has actually said. He's saying that he's depressed because I think physician associates do have a role to play, and that it would be wrong to throw the baby out with the bathwater. And just because of some legitimate concerns that doctors have, that we're going to slam the brakes on or end our physician associates in the NHS. So he thinks there's a role. What should the role be in your view?
I think, unfortunately, Wes Streeting is trying to make the best out of a situation where he has very shallow understanding of these roles. You know, I understand that he's probably been briefed about them and knows a little bit about what a PA is or an AA is. I don't think he really understands the true risks that we are seeing. I think, in terms of a role to play, that's really difficult because it will depend on the scope of practice set by either Royal Colleges or the General Medical Council if they step up to the plate and do it. Ultimately, the way that we would see it ideally would be that they're staying away from seeing what we call undifferentiated patients. So they're the ones who come into general practice or into A&E departments where absolutely anything could be wrong with them. You know, it could be a cold, could be a cancer, whatever. And how do you know that these people are going to be seeing those patients safely if they don't know what they don't know? If they haven't been taught about these really rare and wonderful conditions, you know, these zebras amongst horses, how can we be assured that when they discharge someone from these areas or from, after a general practice consultation, that they're not missing those huge things? And the data that we've collected and others have collected over the last year or so points out that there are real harms and there are real risks, are real missed cases of such harms nationally. So it's hard to say exactly what the safe scope of practice will be. But I think we need to get together with all the Royal Colleges. We need to get down together with the PA themselves. We need to get with the General Medical Council and ultimately determine that scope of practice that is safe for patients.
Dr Matt Kneale, former co-chair of the Doctors Association UK, thank you very much indeed for joining me this evening. I'll give you my 2